How does healing happen today in our lives, in our world, in our relationships? If you pause with us a moment and just drop into the question, for you, how does healing happen and how has it been happening? Just explore what comes up. Many of us have stories and ideas and beliefs about what's actually going on and what's possible. And one of the people that I love to discuss this with is my friend Lissa, Dr. Lissa Rankin. Thank you for coming to talk to us.
It's always fun to play, Shiloh.
We have these conversations for hours. So I'd love for you to start with just giving us a little trajectory from where you started to where you are, just to get a little context about your search regarding healing.
Yeah, well, the more I study, the less I know.
There you go.
I remember having gone through 12 years of conventional medical education at, sort of the towers of intellectual medicine. I went to places like Duke and Northwestern, and the certainty that was instilled in me by the time I was 30, I knew like the Northwestern way. That's what they called it, the Northwestern way. That was it. This was the way that healing happens.
Wow.
And there's an incredible righteousness to it. I remember being 30 years old and sitting down with some of the elder doctors in the hospital to like correct them because they weren't doing it the Northwestern way. And clearly my superior education was far surpassed their years of experience. And I remember them all looking at me like I was this little annoying kind of chihuahua, kind of yapping with my certainty. And I feel far from certain of anything anymore. So the more I kind of go down the rabbit hole of that inquiry, the more questions I have and the fewer answers I have. So, after 12 years of medical education and then 8 years working in the hospital in a very sort of conventional OBGYN practice, I became very disillusioned with the way we were doing healing, mostly with the integrity breach that was being asked of me. When I began my practice, I was expected to see 25 patients a day.
Oh my gosh.
And by the time I left, I was expected to see 40 patients a day, which if you do the math, means that I was expected to see about 7.5 minutes per patient.
Oh my God.
And first of all, healing can almost never happen that quickly. It takes that long just for anybody to tell their story. And as you know from some of the work that you're doing here, we have to be able to tell our story in order to own our story, in order to be able to move our story and clear our story and do the trauma healing that comes with that. And people would just be getting into the story when it was like, okay, time to go.
Oh my gosh.
And I had a devastating day in the office after I had been on call for 72 hours straight, up all night delivering about 30 babies in a weekend. And this one woman had been waiting a year to get up the nerve to actually tell me her story because she was about to lose her marriage because she had so much pain during sex that he just couldn't handle a sexless marriage and she couldn't handle the pain, and he was begging her to go to the doctor and she was so shy about it. She didn't feel comfortable, and so she finally got up the nerve and had made this promise with him, like, I will go to the doctor if you don't leave. And so I had been up all night. I'm wearing my scrubs. They have blood on the bottoms. My hair's in a ponytail. Like, I have no makeup on. I've got bags under my eyes. And here she had to really prepare herself to, like, tell me the story, which was going to include the story of her sexual abuse and all of the things that may have been leading into this pain she was experiencing. And she said, and this was just, it's still devastating for me to remember. She said, I was all ready. She told me this later in a letter. I was all ready to tell you my story, but you never took your hand off the door.
Oh God, I got chills, the worst kind. Oh my God.
And she had sent me this letter about a year later, to say, I'm probably not the first, and I know you have a good heart.
Yeah.
But I just wanted to let you know that I did find somebody who could help me, and I'm doing well. But in case you didn't even know, I
Right.
wanted you to know that there's probably other people that have stories that they want to tell you. But if you never take your hand off the door, they may not open their mouths. Yeah. So I quit. I couldn't handle the feeling of how many people were not telling me their stories.
Right.
Because I wasn't taking my hand off the door, because I myself was so traumatized
Right.
by the system, and I was so traumatized by my own self-sacrifice and martyrdom and sleep deprivation and all of the abuse that I had tolerated at the hands of doctors in the name of becoming an expert in healing.
Right.
And the devastation, the sexual harassment that I tolerated, the physical abuse, like bloody scalpels being thrown at me when I made a mistake, all these sorts of ways that I wasn't able to eat when I was hungry or pee when I needed to go to the bathroom or sleep when I was tired. You know, I'd have to come to work when I was sick. Literally, I used to do surgery with an IV where they'd be pumping drugs in my IV just to keep me functioning as a surgeon until I'd pass out. I passed out once. And on the operating room floor, they put me on a gurney, took me to the recovery room, hooked me up to an IV, filled me with fluids and drugs, and then sent me back to the operating room to keep operating. And that trauma itself, like then you wind up with an entire medical force of people with post-traumatic stress disorder who don't even know that they're operating from their trauma. So I couldn't handle it.
Yeah.
And my dad had just died, and I had just had a baby, and my brother had a toxic reaction to an antibiotic he was taking for sinus infection, was in full-blown liver failure. Like the whole system, and I had just gone through surgery, having a C-section, had to check myself out of the hospital 24 hours after having surgery because nobody was taking care of me. I was literally giving my own orders. And the absurdity of it was just so extreme.
The absurdity of it, meanwhile, it's being sanctioned as the place to go to get well.
Right.
I mean, it's the contrast of, it's that mind space of thinking it's medicine and it not really being. Jonathan and I talked about that regarding the veterans coming back, how part of the psychological trauma is thinking that you're going to serve your country.
Right.
And then while you're there, because you're young and you go in and you're like, yeah, I want to defend my country. I mean, I wanted to join the military when I was younger to do my time. And then coming back or being there and discovering it was really about business, and then coming home and not being taken care of by the businesses that you were supposedly, fighting for. And then now the climate of how we are with veterans is like not like heroes for the most part as a culture. And then what that does to your, like, how do you work that out in your mind? How do doctors and other, repeats itself across many professions, right? Like, how do you reconcile that with yourself without kind of going crazy?
Well, and without getting into this really strong victim story as well.
Right.
I mean, I run a training program called the Whole Health Medicine Institute for physicians, and they come in so traumatized, and if you give them the space to tell their story, it is one story of victimization after another of the ways that they've sold out their bodies, their integrity, their truth as a healer. And they need to tell their stories, and they need to be in community, and they need to feel that they're not alone in that. And at the same time, I look at them and I say, guys, like this, we are medicine.
Yeah.
Like, we let this happen. How did this happen?
Right.
And I work with almost all women, so it's female doctors. How did we let this happen? In the name of healing.
Right.
And it's our own fear and passivity and the ways that we get manipulated by the system, but we let it. We let ourselves get manipulated. Like, nobody held a gun to my head to make me tolerate the kinds of things that I tolerated. It was, just things like, oh, I was actually selling my soul for a paycheck.
But you didn't really know.
No, well, I didn't know there was any other option.
Right. I mean, that's part of it, is that we don't really know. I think that's why both of us at this point in our journey have are about waking people up and supporting people in that awakening. Because if you don't know what's happening inside the systems, then you don't even know how to make a distinction.
Yeah.
And it's traumatic that you have to go through some personal hell yourself in order to go, wait, what is that operating and how did I buy into it? And you don't even know. And then there's the crisis that follows that.
Well, and it's overwhelming. It's
Yeah.
overwhelming, and it's one of those things people don't even like to talk about.
Right.
I was just talking to Shiloh before about how I was writing an editorial with my mentor, Rachel Naomi Remen, who's an 80-year-old physician who's been teaching about healing and consciousness and spirituality and medicine for 40 years. And we wrote this editorial in response to the data that the number 3 cause of death in this country is preventable medical error. So number 1, heart disease. Number 2, cancer. Number 3, going to the doctor or going to the hospital. And this is devastating, not just for patients, but for doctors.
Oh my gosh.
We can't handle going through all the sacrifices that we go through. Financial sacrifices, physical sacrifices, self-care sacrifices. Because we feel called to medicine, the way people are called to the priesthood, it is like a spiritual calling for most of the doctors that I work with. These are like really good people with really big hearts who have a tremendous impulse to serve.
Yeah.
And yet, how do you reconcile that impulse to serve, to be a healer, with people are dying at our hands? And we're also saving lives.
Yeah.
I'm in no way demonizing what Western medicine has to offer, but they're kind of riding shotgun with each other. And how do we sit with, here we say an oath, like, first do no harm. And yet we are in a system that, by its very nature, the side effect is that we are harming people. And I couldn't participate with it, and I had no idea what was next.
And so what was next? So the first book that you wrote was What's Up Down There, right?
Well, the first book I wrote was encaustic art.
Oh, right. So she's also a
an
painter.
Artist. An artist, yep. So I thought, well, I'm just going to be an artist. That was my original impulse, was, well, this is traumatizing, but I can make art. And art was really rejuvenating and really nourishing, and working with my creativity. And I would spend hours in the studio. And I had always said that medicine was my hemorrhage and art was my transfusion. Because I'd go to the hospital and I'd work these 12-hour days. And then I'd come home to my art studio and I'd stay up until like 1 a.m, even though I was exhausted.
Yeah.
Because that flow state that you know so well was so rejuvenating, so energizing.
And you made a lot of vessels, I hear.
I did. I did. The primary shape that I was working with in my mostly abstract art was these sort of vessel shapes with eggs. And here I was an OBGYN, so everybody was always commenting on the eggs. But what I found after I left the hospital was, it was almost like when I was no longer hemorrhaging, I no longer needed the transfusion. There was something that was off, and I was missing the service aspect. Because my art at the time was not the kind of art that you're doing. It was not medicine itself. That's not fully true, because I did the Woman Inside project where I was working with women with breast cancer.
You were using it as a survival technique
It was
at the
a survival
time.
technique, yeah. And I was doing a lot of art for the hospitality industry, making pretty paintings to go with people's sofas.
Which is not it.
Which was not, didn't have that feeling of doing healing work.
Right.
So it took me about 9 months to realize. I was at Esalen when I really had the awareness, and that the impact of that it was 9 months was not lost on me.
Right,
The irony
of course
this.
not.
That I needed to continue with my healing work, but I was not willing to do it inside of the integrity breaches of all of the ways that I was selling my soul to cooperate with the system. But I had no idea what that was going to look like. And so it started by me going back to medicine, but under the guise of integrative medicine, which really wasn't integrative medicine at all, because I wasn't prescribing drugs, and I wasn't prescribing supplements, and I wasn't ordering expensive lab tests. I was just talking to people who had medical charts this big. And I felt really helpless, because I had moved to Marin County, where, these patients, they were, they had been to the best doctors at Stanford and UCSF, and they had their naturopath and their acupuncturist and their personal trainer and their raw vegan diet, and
They
they're
were going to
taking
yoga.
20 supplements and going to yoga and meditating,
And still.
and they were some of the sickest people I have ever seen in my life. And so I felt really helpless. I'm like looking at their charts going, I don't know what I have to offer these people. But
Imagine that moment. And maybe you've had a moment like that too, where you're just like doing everything you can. And then on top of it, you feel bad that you're not able to heal it yourself. So you couple the
Yeah.
belief that's also really popular in the Bay Area about you have created this for yourself so that you can transform or learn a message. Not that you don't get a message and transform, but the shame that often accompanies being sick at all and how we don't talk about it. Because if you do, a lot of people are going to react with, well, what are you doing? Like, how did you create that for yourself?
Right. The whole law of attraction.
It can be pretty
if
dangerous.
I created this, then I should be able to fix it. So there's this story of control, that I should be able to control this. Either Western medicine should be able to control it with me, and if that doesn't work, then all these alternative medicine techniques, and if that doesn't work, well, then there must be something wrong with the way I'm doing it, and I just need to affirm and visualize and see my white blood cells fighting my cancer or whatever.
Which actually often energetically disables the capacity to really know what's going on, because this huge belief is put over a symptom package that is then difficult to see what there really is.
Well, and as I later learned in the work that became my book, Mind Over Medicine, well, that very thinking actually puts the nervous system into stress response.
Right.
Wow. And all of our bodies have natural self-healing mechanisms. We know this. They teach us this in medical school. It's in all of the physiology texts that, every day we make cancer cells. Right now, we're getting exposed to bacteria and viruses and fungi, and we're fighting off cancer. We're fighting off infection. Different proteins are getting broken, and our systems know how to repair these things. But, and this was a key thing in my own learning, because this wasn't taught to me in medical school, those self-healing mechanisms only function when the relaxation response is activated through the parasympathetic nervous system, or the sort of homeostatic mechanism of the body. So even the belief that says, well, I should be able to control my illness, and it's not working, so something's wrong with me, or I'm not doing it right, or the universe is punishing me, or whatever, that very belief will activate the limbic system that, puts us into fight or flight. There's like a threat response that activates the hypothalamus, that turns on the pituitary gland, that spits out the adrenal hormones. And next thing you know, you've got cortisol and epinephrine, and all of the self-healing mechanisms are disabled.
Wow. Can you believe that? I mean, isn't that just like, it's like the opposite of what you think is happening? And then all of the stuff that goes on in response, it's like this cycle, right? You just get into this cycle of reactivity and continue to sort of re-injure. I mean, I think that's why my focus has been so much around healing, but through creativity, because I know that when people are creating, even though it does bring stuff up, there are 5 minutes and 20 minutes and sometimes hours and hours if you're a musician, when you're dancing, when you're painting, sometimes when you're cooking, all of the things that involve, I would say, a form beyond the mind, where there's some motion, matter part of it, where you can enter into these states of absolute relaxation, but not where you're like trying to relax, because trying to relax, doesn't always work very good.
As any meditator with a monkey mind can tell you, right?
Exactly. But creating can actually take you there pretty quickly. Like when I work with young girls who are not speaking and or cutting, and I don't really know what to do with them. I'm not a therapist, but if I can get them drawing, what ends up happening is they just start talking a little bit. And if they can just start talking, I can talk to them and we can make a plan. And so we start making marks on the paper instead of on our body. And just those transitions are so subtle, but that's why I believe so much in the power of creativity. And part of why I wanted to bring you here too, to talk about the intersection of what you're working with now and creativity, and our mutual interest in what is happening with healing in the world right now. And then there's a search for the sacred medicine.
Right.
It's on. You know that. You're part of it.
Right. Well, so what ended up happening was when I'd had these patients come into my office, And I had an hour with people at this point because I was going outside of the system,
Yeah.
which I didn't love because it felt elitist. You know, in order to be able to have an hour, I couldn't accept insurance. And now I'm only able to work with people that can afford to pay for an hour of my time, and I have overhead and all of this.
Right.
So I still didn't feel fully in integrity in that way of relating, but at least I had an hour with people. So it was nourishing to my soul. Even if it was inside of a structure, I still really believe that we should have socialized medicine and everybody has a right to good health care, and we should be offering our sacred medicine through the tribe as part of just, human right. But that's a whole other conversation. But given the constraints of what I did have an hour with people. And so with that kind of spaciousness and being able to hold the space of like, oh, here's this person, right? And there's something going on in this body. And if I approach it as a mystery and I'm just inquiring with this mystery and holding like my deep love for this being and feeling my care for this being and just wondering, I started just kind of spontaneously and intuitively asking questions like, sweetheart, what's your body saying no to? Or, and people would just burst into tears. And I had been shadowing, kind of watching one of the other integrative medicine doctors that I was working with for months, and none of her patients were crying. So I was like, something's wrong with me. But I realized that it was something about the space that I was holding was melting the ice around the heart, and the heart was opening, and this was evoking trauma. People's trauma was coming to the surface. And so I would say things like, what does your body need in order to heal? And I would be shocked at how quickly
They would know.
people had an answer like that.
Right.
Like, I've got to leave my abusive husband. I've got to quit selling my soul for a paycheck.
Right.
I've got to put my mother in a nursing home because she's, toxic in my system. I've got to go to art school.
Right.
Because I've wanted to be an artist my whole life, and my grandmother told me that I could never make a living as an artist.
So maybe you could ask them.
I know, but I get so caught up.
I know. I'm just like, let's ask you. See, because
Yeah.
an answer came from me as soon as you said it. Right? It's right there,
Right.
and it bypasses so much of the processing of like the symptoms, and there it is.
Right. So I know you all are working through some of your stories, working through some of your traumas, and moving this through your body and out your hands and out the paintbrushes and onto the canvas into a place where we can work with this. So assuming whether you're working with something that's a physical illness or an emotional illness or a spiritual illness, assume for a moment that there's some part of you, I call it your inner pilot light. Assume that that part of you actually is the most valuable healer that you could ever have access to, and that you can consult this inner healer anytime. And if you evoke that thing that is in need of healing that you're working with right now, and just ask, what does my body need in order to heal, or what is needed in order to heal this thing? And just don't think. Yeah.
Thank you.
Yeah. Sometimes
Yeah.
it's quick.
Yeah, it can be.
Yeah.
And then the wonderful thing is you can begin to address that. And that doesn't mean like instantly you're going to be able to make that thing happen, like quick as it came to you. But what we've both discovered is that when you become conscious of the source of it, then you begin to navigate it. When it's really feels out of control is when you don't know what's operating behind the scenes. That's why the hidden stories can often be so harmful, and we can be caged inside the hidden stories. So just becoming aware, that just looking at it as the observer could actually take the charge off and maybe even point to something else too, right? Because you're like, oh, that's what's driving me crazy, or that's what's making me feel so sick, or whatever it is. And then the next layer can come. But unless you can get to that first layer of responsiveness, it's difficult to do the deeper work.
Well, so when this happened for me, because I was taking 7 drugs for a whole host of chronic health conditions myself by the time I was 33. And so when it became obvious to me that it was time to leave the hospital, it had come through this voice of my inner pilot light that was so loving and so gentle And I just heard this voice one night when I was it seems like a lot of people have their like epiphany moment on the floor of a bathroom. So I was one of those having my suicidal moment on the floor of a bathroom when I heard this little voice that was like, sweetheart, you're going to have to quit your job. And of course, then all the mind stories start coming up. Well, I can't do that. I'm pregnant. I have a baby on the way. My husband isn't working. I have a mortgage. I've spent 20 years practicing to be a doctor. I can't just quit my job. La, la, la. But the voice was so calm. And so the next thing it said was, you don't have to do anything about it right now. All you have to do is make peace with what's true.
Yep.
So that's the next invitation. Is whatever comes up for you, all you have to do right now is make peace with what's true. And there's something, when you hit on something that's true, like the nervous system already starts to calm down, right?
Yeah.
Like that relaxation response is like relief.
Yeah.
When you come out of denial,
Yeah.
and you don't have to think about the plan yet. You don't have to activate.
Don't go immediately into planning.
No, it took me a year and a half to quit my job.
Once you got the message.
After I got the message. And that's okay. But there was, that whole time, there was like, something just dropped, like that,
Yeah.
right? Because I knew it was true, and I knew it was inevitable, and I knew I would die if I didn't do it. Because I was actually having all these cardiac problems. I was like, oh, I'm going to die by the time I'm 40 if I don't do this. And I knew it the way you just know, that you know, that you know, and you don't know how you know. So I knew it was actually my opportunity to save my own life. So you may have that knowing, but there's something, the knowing itself is medicine.
Yeah.
So the minute you actually just make peace with what's true, without shaming yourself, without pressuring yourself. I love our friend Karen Drucker has a song, and one of the lines in the song is, I will only go as fast as the slowest part of me is free to go. So if you have the resistant parts, just let them know, like, relax. We will only go as fast as the slowest part of you feels free to go. And then that further kind of relaxes the nervous system. And then this inner healer can start to take over in a way where if you trust it, all these different parts inside of you that may be at war, that are polarized with each other. You know, you have the inner critic, and it's fighting with the wounded child that is in exile because we've kind of isolated these parts, and we don't even want, we've put the trauma bubble around these things that have happened long ago often. But this is part of what I'm learning in my sacred medicine research. I'm 6 years now into researching a future book called Sacred Medicine, where I've been traveling around the world working with shamans in Peru and Qigong masters from China and energy healers in the US and kahunas in Hawaii and Balinese healers and such. And I've been looking for patterns, really trying to find, like, is there any overlap here? Because everybody has their system, and they're all talking in these esoteric languages.
Right.
And it's so complicated, and they spend lifetimes, like, getting initiated into these various practices. But I've been, the intellectual synthesizer part of me has been trying to find patterns.
And so what have you found?
And the biggest pattern that I've been finding is that all of these systems are oriented around getting to the root of these unhealed traumas that live in our fields, that live in our systems, that we're blended with, or that we're completely in denial. And it's not even, they're in our unconscious space, but they're playing out through our reactivity, through our physicality.
And shaping our future choices. I mean, this is it's one thing to just be suffering along with the stories, but it's another thing to keep creating the future from the wounding of the past, or what we would talk about as the continual avoidance of suffering. Like, I'm not going to go over there. I'm not going to take that risk. I'm not going to fall in love. I'm not going to try that thing because this thing could happen. And so as long as it's unaddressed and unconscious, then without our knowing it, we think we're making a healthy choice, like, because we're trying to protect and using discernment. But if it's connected back to the old wound that hasn't become a teaching, then we're making choice from the fear of being hurt again. When the wound or trauma, or however you speak of what the story, becomes a teaching, not meaning like you know the reason why it came, because that may be unknowable, but what you ended up doing with what happened, like how you actually curate the story of what happened after, how you allow it to live in you. Have you translated it into medicine where you can tell story and serve others or serve yourself, or made it into, your personal way of being in the world? Like a lot of us have our scars as part of our, like it's part of our story now. We've sort of really claimed them. That's a part of Cosmic Cowgirls, right? It's like we're taking it all and we're using it all. We're rebels, right? So we're outlaws. We're going to bring it with us. You don't have to get rid of it. We're going to take it forward. So we all have different ways of sort of translating how to work with what's happened. But if you don't know what's happened and how it's shaping, then it's just operating in the background. And then you're much more susceptible. I'm much more susceptible to buying into the system's prescriptions. And the system could be, traditional or non-traditional healers, any kind of a system, because you're not able to hear your own self speak about what you really need.
Right. Well, so the one thing that, and I'm about to say something I've never said publicly, because it's edgy.
Bring it.
But hey, we're with Cosmic Cowgirls, right?
That's right.
Yeah, I'm really coming to believe that at its most basic level, that all illness and injury is the result of trauma. And it may not be psycho-spiritual trauma, right? It might be that there is a toxic waste dump in your backyard and it is causing your cancer. So I'm not saying that every cancer is the result of your thoughts, beliefs, and feelings. It may actually be from the toxic waste dump. And, I like to use the example of my ex-husband who cut 2 fingers off his hand with a table saw. That was a very obvious trauma from a physical injury. I was attacked by a pit bull last year and went through a 6-month sort of self-healing journey outside of the conventional medical system to let that come together. But even that, like, I'll use my own example because I'm very sensitive to anybody who isn't very particular about the languaging around how do we create our reality. But I personally, in my own experience, when I went through this devastating injury, I had a hole this big and this deep on my inner groin, about an inch from my yoni. And so for me, I went through the process of, yes, it's a physical injury caused by something outside of myself. But if something in my field was susceptible to that, am I willing to be in the inquiry of what else could have made me, why did I get bit that day and not 100 other people that were in the same place? Like, what made me vulnerable? Just like if we're in a room and there might be bacteria in the room and one person might get pneumonia and 99 people don't. What might have made me susceptible? And I was able to locate what was actually happening right at the time that I was attacked by this pit bull. I had just had a fight with my boyfriend and I was attacking myself. And I was beating myself up, sort of, biting myself. Could I have been broadcasting in my field, bite me, it's okay to attack me, I'm doing it myself? Could that have made me vulnerable to that? And I don't know if that has anything to do with it. But I find that if I'm willing to explore on all of those levels, like maybe I just was like too friendly with a pit bull, that was on a leash that I trusted. Maybe I have boundary issues. But if I'm willing to be in inquiry about these things, then what I find is that inner pilot light can often come in and download a whole series of things that will help me do some of the trauma healing that then makes me available to the self-healing process that put my leg back together after doctors told me that I would need skin grafts and surgery, and my intuition said no. And then B, how do I prevent future injuries of something similar so that I'm not just putting a Band-Aid on what's going on so that I then get another injury or another illness because whatever's in my field that's coming from a trauma is playing out again. So I think it's really important when we talk about this as well, that part of coming out of denial, I think people sometimes think, especially when you talk about trauma and illness, that trauma is only like capital T big trauma. Like, I've never been sexually abused. I had a really relatively very benign and healthy childhood. My parents were together for 40 years. There was no divorce. I didn't grow up in a war zone. Like, if you look at my childhood, I had, sort of the idealized American, upper middle class upbringing. And yet, if you look at the definitions of trauma that a lot of trauma therapists use, many of the things that happened in my childhood shaped my thoughts, beliefs, and feelings and the perception of how I view the world and the traumas that I attract in my present day. And I'll give you an example again. I recently was working with something that got lit up, a trigger that got lit up with my ex-lover, who was not believing me when I felt innocent. I was doing something that I considered loving and spacious and generous, and he felt like I was being manipulative and controlling, and I felt blamed for something that I hadn't done. And my reaction to his trigger, my reaction to this situation was kind of out of proportion, like an exaggerated response. And I was aware of that. Like, wow, this actually doesn't feel like it's about him. So I went into that inquiry of what might be getting lit up here. And I had this vision of being 4 years old, and my brother was 2. And my brother, who was this tiny little toddler, just kept beating the crap out of me. And I would try to defend myself, and my brother would scream, and my mother would come in,
And blame you.
and my brother would say, "She hit me," and I would get in trouble when I had just been sitting there drawing, and my brother's the one hitting me, and now I'm getting punished when I was innocent. And it was that same feeling. And I realized when I located that, I started bawling, because I realized that my life is a series of feeling like I'm getting punished when I was innocent. And it just happened. I just went through a court case where I ended up like the ultimate exaggerated,
Playing that
like
out one more
playing
time.
it out in a courtroom where, oh my God, I'm innocent and I'm getting punished.
Wow.
And I was like, crap, this is what happens
Yeah.
from something seemingly small.
Right. Something you wouldn't identify as a major trauma that shaped you so much.
Right. I'm 4 years old and my little brother is, hitting me.
What's a big deal?
Like, no big deal. This is not like I'm not a war veteran.
Right. Right.
But here it is still in present time at 48 years old, playing out in the
Living
most
itself
extreme way.
Right.
And so I realized I need acute help around interrupting this pattern, or it's going to keep playing out.
Yeah. Yeah. Amazing. Good on
This
you.
is exciting, I think.
Yeah.
I get super passionate about this because it means like, oh, I'm not just a victim of that.
Yeah.
And literally, I went to do some energy psychology work with Asha Clinton, who created the energy psychology technique AIT, Advanced Integrative Therapies, which is, I'm fascinated. She's one of the people that I'm studying for my sacred medicine book. And she's a former Princeton professor, like fully credentialed PhD psychologist, who's also a mystic healer, Sufi practitioner for 30 years, who, has been able to systematize and reverse engineer everything that's come to her through her mystical gifts from her spiritual path, but has been able to turn it into protocols that she's trained 2,000 therapists to use, and they're using it as primary treatment for cancer. Which to me is fascinating. So I went to do this work on that pattern, and I swear to God, people that I've had this pattern, including my ex, who I felt wasn't trusting me, all of a sudden it's like magic. It was like all of a sudden people that had not been trusting me or believing in my innocence were like, oh wow, now I believe you. And they didn't even know I had done this
Right.
work.
So it's in the field.
It's in the field, and
in the
shifting it changed three-dimensional time and space reality. Like,
wow. Right. Yeah. So maybe this is bringing up for you some of these ways that we continue to play out scenarios. And I love this point that it doesn't have to be this super, super huge trauma, but that just really, really shapes you. And one of the, recently we were in Glen Ellen, and I've always missed Glen Ellen, and I didn't know why. And whenever I'm there, I always want to move there. And I was telling Jonathan the story about leaving. And when we were leaving, we actually got forced out of the town because my family had been protecting rape victims or people who experience rape. And so rapist community was attacking us. And so my cousin and I weren't safe. So we actually fled the village. And so every time I go
Wow.
there, and so, but what happened? So there's that. It was like, wow, I knew that story all my life, but I hadn't given it the right language.
Yeah.
But I realized I'm always escaping that gang of motorcycle guys. Like I am
Wow.
continually running from them and trying to tell everyone about them, which I've sort of translated into the patriarchy, is this
Right.
gang of, motorcycle guys. And I'm always running from them and telling, don't you know they're coming? And that comes back from, I guess it was like 7 or 6 or something, but that same kind of thing. And what am I creating in my life? Because that fear is constantly like, they're coming, they're coming, they're coming, they're coming. And we're trying to protect people. So if you try to protect people and you tell the truth, because we were bringing this trial to the court for the first time in Sonoma County. It's the first rape trial in Sonoma County. If we try to protect women, they're going to come after us. Am I not? Anyone who knows me knows that's what I'm constantly doing. And it isn't even that, in that case, it's that bad of a thing, because actually it's led to me being protective and advocate for women. But being unconscious of it means that I'm continually responding to it. So I feel like...
And getting evidence in
building
three-dimensional
evidence.
reality that is a true belief
It's
and
always
a true
happening.
story.
Yeah. Like a lot of indigenous people who were in, conquested environments, in their village now, even if the conquest isn't still happening, in nonlinear time to them, it's always happening. And so it's not just trauma-based. It's actually an old way of thinking that our people have had for a really long time. So maybe this has brought up stuff for you that's playing out. And I think that it's important for us to share something with you that we've talked about a lot regarding how things happen and the causation of things. And when people talk about that something happens for a reason, and they call it a truth or a law, I think that's where the difficulty is. So what Lissa's saying, for her, she said, for me, my experience is this happened and I was able to look at it. But that doesn't mean it's true every time. So not every person who, has a cancer experience created it. There is toxicity, but some people might based on their trauma. So I think that part of the empowerment is that there isn't a law or truth around it. It's whatever is really your experience of the story, and to really shed other people's ideas, including healers and experts, about how it goes, how it's happened, but to also free yourself from feeling like you are responsible for every part. Because notice that responsibility sometimes actually disables you. So what part of the inquiry empowers you to do the work and take a look, and maybe you'll end up finding there was nothing over there,
I want to say something to that, because this can actually be really simple. The part that's not simple is learning to access the voice that I'm talking about, this inner pilot light. I just wrote a book that I delivered 2 days ago to Sounds True called The Daily Flame, 365 Love Letters from Your Inner Pilot Light, which is part of a free email series that I've been doing since 2009, helping people try to recognize, like, what does that voice actually sound like? And how is it different than the inner critic? Or how is it different from all of these other multiplicity of voices that are in our heads, trying to give us advice, and which ones can we actually listen to? But when we can access that voice of the soul, of your truth, of your essence, your center, whatever you want to call it, you can actually ask, is this physical symptom? Is this, psychological symptom, whatever? Is this related to something, to a trauma-based thing that is unhealed in my system? Is this a psycho-spiritually based issue or not?
Right.
And sometimes that part will say, nope, it has nothing to do with that.
Yeah, and that can be extremely liberating.
Super liberating. So that's why I say, for me, it's an inquiry. Part of the inquiry is almost like a decision tree. Mm-hmm. Is this related to something psycho-spiritual? Yes, no. If yes, go here.
Yeah, completely.
So, and if yes, well, there's just to approach it with open curiosity and like a tremendous amount of self-compassion.
Yeah.
So that it's not a self-blaming. It's not buying it. I love what you said about like letting go of what any teacher says. Like, this part of you knows better for you than anybody else. I don't care how long they went to medical school, or how many years they've been practicing a spiritual path, or how many energy healing clients they swear they've, healed. Yeah. Nobody actually knows better than your own Yeah, your own soul.
And yet,
What's right for you?
getting in there, I mean, that's where our work, although different, is the same with her inner pilot light. In our community, we engage it through what we call the muse as the counterpoint to the voice of the critic. And in our work, the critic and the muse become one voice, your true voice, and there's no longer that separation, which has the effect of feeling less crazy. The voice of the critic becomes a discerner and a protector instead of an aggressor. But how do you begin to really authentically hear that? And when we're creating, that's what you're listening for. And that's why we take the perspective of the observer. The more you begin to listen for how it's working while you're distracted, so you're beyond the, dominatrix of the prefrontal cortex. You've moved beyond because you're actually like out here making something. Other functionality starts to happen, and the voice actually begins to change than if you're sitting here saying, what does it sound like? And all you're hearing is, well, what does it sound like? Well, what are these people even talking about? And the chatter sort of ensues. So it's this idea of being engaged in a journey defined by an intention that allows you to then begin to hear that true voice and to hear it before you're on the bathroom floor.
And it may, yeah, absolutely. And it may not be a voice. It may be a vision. It may be, you just know that you know that you know. You wake up one morning and you just know. It may come in a dream.
Yeah.
People receive their guidance in so many different ways. And it may come even in ways that look like it's not from inside you at all. It may come through synchronicity or through, a random psychic on the street who's like, I have a message for you, or something that comes into your inbox.
So the point is knowing that it exists. If we talk about consciousness, number one, know that this consciousness exists, and you ask yourself what my teacher Sue said, who lives in here? Right. It's the oldest question of the human being. It's like, who am I? Who's doing the looking? Who's doing the asking? Who's listening right now? And to make a contact, a direct contact with that kind of presence so that we can be directed in the path ahead, and so that we together can explore how we can be more and more free to be who we actually are.
Well, that's part of what I love about what you're doing here, too. So you're actually evoking guidance.
Right. Exactly.
Right? Like you're opening yourself to the inquiry of what is needed, what do I need in order to heal?
Yeah.
And then allowing that consciousness to come through the body in this way onto the painting to give feedback and information that you can then work with. Because, we can ask for it. I think actually this is part of the exciting part, is that we can actually ask for help.
Yeah.
We can ask for help. If you don't know what you need in order to heal, there's like a humility in being able to say, I don't know, I need help.
Yeah.
And I think that's the opposite of the certainty of, I created this, therefore I can fix it, or the doctor knows and I'm certain. That there's no space in certainty. But if we're able to be in the humility of, I don't know, but I'm open and I'm listening, and I trust that everything is alive and conscious and trying to give me feedback to help me to heal, to restore the wholeness that has been there all along, then everything can become your healer. The animals that cross your path that are like spirit totems giving you information. The book that drops off the shelf and opens just to the page with exactly what you needed to hear right in that moment. I mean, everything becomes available, including that which you can access through your creativity in a way that actually moves. It's not just bringing it into your awareness. I think the deeper we go with the inquiry, if we don't just notice it as like, wow, the universe, it's a sign from the universe, something's communicating with me, and what else, and what else, and what else. And many, many spiritual paths are based on that practice of inquiry. If we can just continue to be curious and not know, and be willing to go into that humble space of surrender to the flow, to the mystery of what can come up through that space. And that's what I keep finding in these healers, as well as they all have practiced accessing that state of humble, open awareness and letting go from a non-attached place where that which is in need of healing is is making contact with that which can heal.
Mm-hmm.
And that can look like so many different things.
Totally, yeah. So it's like making yourself, you and the ones you're working with, making yourself available to that which is available. You know, if we're just blocking it, then we don't even know that it's there. So
Right.
there's like an invitation to become supple to what is available. That's like step one, right? Like, I want to know, show me, right?
Right.
So thank you so much for coming. It's a pleasure, always wonderful to explore with you and dive into the modalities and the work that you're doing. And I appreciate you coming and sharing your
Thank you.
story.
It's always fun to be here, and thank you all for the invitation that you're opening yourself to for this, because it takes courage.
Truly.
This is like really badass brave work. So, and of course, that's totally consistent with Cosmic Cowgirls.
That's right. Thank you, dear ones. Many blessings. And just remember that when it remains hidden, then we can't really work with it. So the great revealing is a big part of the journey. And if we can approach it with curiosity, sometimes we can even have a good time in the process. So many blessings.